Welcome to 340B 360, a new monthly podcast from 340B Report. I'm Anna Mangum, host of this new program, which will showcase 340B Report's valued sponsors and the crucial role they play in the 340B ecosystem. If you're not already a subscriber, please consider subscribing to 340B Report by going to 340breport.com and using the coupon code PODCAST25 to receive a 25% discount. If you did not hear our first episode, here's a little bit about me. I've dedicated my career to promoting healthcare access, quality, and equity. I've been a senior leader with a variety of major national advocacy and trade organizations, including 340B Health, where I worked closely with 340B Report publisher and CEO Ted Slavsky for over a decade. I'm delighted to join the 340B Report team and to be working with Ted again. In this exciting new episode of 340B 360, I chat with Mickey Price, Chief Operating Officer at Pillr Health. Pillr Health is a technology and services company for covered entities participating in the 340B program. It was created by the merger of RxStrategies, Hudson Headwaters 340B, and RPh Innovations. Pillr Health is an Ultra Diamond sponsor of 340B Report, the highest level of sponsorship. We're very grateful for Pillr Health's investment in 340B Report. Today, we'll catch up with Mickey, learn about him, and gain insights about his company. We look forward to learning more about Mickey's career, the services that Pillr Health provides, areas that 340B providers should be thinking about when it comes to staying compliant and becoming more efficient, and also in bringing much-needed revenue to meet their safety net mission. Welcome, Mickey, and thank you for being with us today.
Hi, Anna.
Can you tell us a little bit about your life before 340B, including where you grew up, where you went to college, and what you majored in?
Sure. Grew up in Northeast Ohio. Went to pharmacy school at Ohio Northern University, and currently live in the state of Texas today.
That's great. That's great. How did you begin working in 340B? Did you start out there, or did you kind of come to that after doing other things?
Yeah, Anna, it's been somewhat of a journey. I've had a pretty long career and an opportunity to do a lot of different things in pharmacy. Started in retail, went into hospital practice, spent some time in pharmacy, building a 503B injectable manufacturing operation up in the Northeast. And that's what's led to where I am today. Most of my career, or a large majority of my career, has been with Cardinal Health on the provider services side, where I've had a chance to start as a pharmacist all the way to leading a large group of hospitals in the western part of the United States. Even had a chance to start up a telepharmacy business with Cardinal. How I got here is an interesting story, only because once I left Cardinal, I got involved with a private company who was interested in selling their business and helped them do that. And we actually got it sold. But during that time, I was looking for, hey, what's the next opportunity look like? And my paths crossed with a company out of Dallas who really has a strong legacy in consulting. In this company in particular, I was interested in starting a 340B program. And if you think about the consulting business, it's not necessarily the operating business where you have to scale and think about some of the, routine processes that go into, creating a stable program. And he wanted somebody with a pharmacy background. And that's really how the initial connection actually occurred. I was not familiar with 340B at the time. Most of my time in the hospital space has really been on the for-profit side of the equation. And for those that have begun a journey in 340B, it's a little bit different. It's a very mission-driven industry, if you will. I mean, if you think about why we do things, it's pretty compelling when you're participating in an industry that's really designed to help the uninsured and underserved. And after I got to know it, and most of us that are in the industry, you can't help yourself but be excited about the mission of the program, what it's designed to do. So it's really a great place to be in. If at the end of the day, if you can't get excited about that, I'm not sure what you really can get excited about.
Yeah, it's great how you highlight the mission of 340B and how it's a different space in the pharmacy and healthcare environment broadly. Having initially worked in pharmacy in areas outside of 340B, what do you think is unique about the 340B space? You mentioned the mission. Are there any other aspects of 340B that you would say are a little different?
I would say, it kind of starts with the mission, the purpose, right? Why we do what we do. What's unique from a 340B standpoint is it's really intentional in focus, if you will, around the safety net providers that exist in the market. And what I have found really fascinating is the adoption of the program over time. I started the 340B journey back in 2015, and it is quite amazing how the program has really grown positively around how, whether it's in the hospital space or the FQHC grantee space, the level of service that has been allowed to be provided because of the program value being, generated for them. It's really truly exciting to be part of that journey.
That's terrific. Well, Pillr Health, it was formed through a merger between RxStrategies, Hudson Headwaters 340B, and RPh Innovations. What inspired this merger?
It's probably a combination of a couple things. As we know, the industry has matured quite a bit. Typically, around maturity creates opportunities where organizations that are complementary to each other come together, if you will. And I think that's kind of what happened here. So when you think about the organizations that are brought together here between RxStrategies and Hudson, RPHI, it really is a pretty good fit around culture, client portfolio, and the product portfolios that each of those organizations collectively really bring together. Just to kind of highlight a little bit about each of the companies, RxStrategies has been doing this for 23 years, obviously extremely committed to this industry. I know Fenton Markovich was really the backbone for many years, and now Skip Devaney, who is the CEO and now is the CEO of Pillr Health, wants to continue, to move the ball forward, if you will. Hudson, really unique, right? Initially led by Jim Donnelly and then Nick Redmond. Hudson's a really interesting background, coming from a nonprofit FQHC, built a program and now determined how they could best commercialize that program with the same culture and service mind, and decided to create an offering to extend those benefits to the broader market. And that's really pretty cool, right? Because they didn't really have to do that. And then RPHI, still a little bit different, right? I don't know. Most people know Rob Johnson, entrepreneur type of guy in his own right, but, believed in a very high touch, white glove type of program. And their solutions probably as close to outsourcing 340B for those clients that just don't have the resources on site to do that. Rob's obviously now enjoying his time off in retirement. But, Skip's done a great job creating the vision to bring these really complementary organizations together, creating better accessibility, right, to solutions, to different products, to expertise for the clients that we know every day. Some of their demands continue to change.
Yeah. Well, the deep history and knowledge of the 340B program that these respective companies have brought to this merger is truly impressive. How do you work to ensure that you're able to keep that hands-on approach when the company is now much bigger?
Yeah, I think it starts with, having organizations that are very service-minded in culture. I think it kind of starts there, makes it a little easier as we, assimilate together. But more importantly, I believe between the organizations, the values are the same. So when you think about our values today, integrity, service, innovation, very consistent across the organization, which definitely makes this pretty easy, if you will. And part of that, we all have the same mission, right? We all have the same purpose and a strong commitment to the clients and to each other. So it's pretty fundamental within the broader group now. I would say, I don't know, these are really fun times. Now having a chance to work with colleagues that we all used to compete against. So it's like, hey, it doesn't get any more fun than that.
That's great. Well, how did you come up with the name Pillr Health? What does it mean?
Well, Anna, that wasn't our first option. Our first option was Remedy Health. And unfortunately, there were some commercial conflicts that prevented us from doing that. But I think we landed really on a better name, Pillr Health, because it stands for a couple different things, right? You think about pills, think about prescriptions that are filled that we process within the 340B program. But more importantly, I think it also is a bit more maybe aspirational, if you will. If you think about the word pillar, column, right? A term used to, I don't know, describe what strength, creating really a strong foundation for the future of this industry. So I think, the name's pretty appropriate.
Where are you based? How many staff do you have?
Yeah, so our corporate office is based in Boca Raton, Florida. We have more than 170 employees. Hudson still retains their office up in New York, but largely we're a regional remote-based organization, which I like because it allows us to stay in better proximity to our client base.
You've talked a lot about the merger, the respective organizations, what each of them did. Tell us about the key services that you provide to 340B stakeholders and to the larger healthcare supply chain.
What's really fortunate to the broader market is when you look at the breadth of our portfolio and the depth of our client base, it is highly variable. We have, 9 software and service products offerings that are out there, and we support more than 12 different client types, both covering the hospitals and the grantee space, if you will. I would say our solutions are very much grounded in our technology. And when you think about the knowledge base expertise that is supporting that technology through the various 340B offerings we have, we're a pretty comprehensive end-to-end solution provider.
So what is it about Pillr Health that you think makes it unique and particularly valuable to the 340B provider community?
My quick response is, aside from, bringing complementary assets together through the acquisition, it's really an organization that really is built on passion around the mission that we had talked about previously. But more importantly, because of the breadth of our portfolio and the experience we have across a large client demographic, it really allows us to tailor the right solutions to the specific needs of the customer.
Terrific. The restrictions by some 40 drug manufacturers on contract pharmacy use have had a major impact on providers and their patients. What are you seeing in terms of those impacts?
Yeah, I would say yes. These restrictions have certainly had a global impact to the industry. We're seeing, the ranges vary, right? It depends on the mix, the type of facility they are. Could be up, upwards of 40 to 60% impact. However, as a result of the manufacturer restrictions, we're also seeing pretty strong participation in the ESP program, where they have to report, their data to access 340B pricing. And even within that subgroup, if you will, we have a certain demographic of client that prefers to do their own self-reporting, but we have a large group that really needs our help, right? So we do a lot of submitting the data on behalf of the client. So we do both those things.
That's terrific. Are there any other things that you're doing in terms of helping clients navigate this, since the rules do seem to keep changing?
They do seem to keep changing, probably I guess it was almost 3 years ago when the restrictions began. It almost appeared they were really focused more in the hospital space, but within the past year, we've seen the requirements begin to change and affect, the grantees in this world. And at the end of the day, the requirements, they're not static. They change routinely. We have a program led by, Casey Nelson. He's our chief pharmacy officer that manages and maintains not only all the requirements around each manufacturer, but he provides guidance and updates to our clients so they get the most current information. We also, through our business intelligence reporting capability, have the capacity to do the appropriate analytics and evaluation so we can, make recommendations to our clients and so they can better understand what opportunities or what impacts a program like this is causing.
So, those are great resources and services that really are meeting the moment that these providers are in. What are some of the ways that your clients have been able to mitigate the loss in savings, and how has Pillr Health helped them adapt and change? I know that you have an incredible team of specialty pharmacy veterans in your organization, and this includes some executives who started the well-respected Vanderbilt Health Specialty Pharmacy Program. Can you tell us more about that?
Yeah, a couple things I'd probably call out and maybe provide this perspective because I think over the past few years as well, we've seen hospitals as well as FQHCs begin to build their own pharmacies, right? Both retail pharmacies as well as specialty pharmacies, and that caused us to think about some innovative approaches to be able to help them from that front. So what you mentioned is a product called Specialty Pharmacy Accelerator. It born within that Vanderbilt group. Really cool solution that has a lot of different features that could be applied depending on the needs of the particular client around specialty pharmacy itself. Very deep in knowledge and skill set within how to build a pharmacy, how to operate a pharmacy. So they do everything from designing a program, optimizing workflow, designing a facility, managing a facility, getting accreditations for LDD drugs, providing performance benchmarking, doing reporting. So as you could see, it's a very comprehensive end-to-end solution that if you want the total end-to-end solution, that's available to you. But if you're looking for a small cross-section of that, that's available to the customer as well. The other thing I would point out, Anna, is relative to those in-house retail pharmacies that have been built over time. We have a program called ECAP, ECAP, and it's really designed to support these retail operations in-house. You build them because you want to capture as many scripts as possible. And, we've designed a solution that will allow them to understand what their capture rates are and how they can improve their claim monitoring and verification, as well as streamlining enrollment. And so the whole idea is how do we help our clients optimize something that they built? And part of that's 340B related, but part of it's not 340B related. So it allows them to capitalize on some additional, savings for their program with some of these other impact areas that are impacting the core 340B program.
They sound really robust. So thanks for detailing that. There has been a lot of progress at the state level on restoring access to 340B pricing in the contract pharmacy space, as well as more and more bills and laws that would require additional reporting requirements on 340B providers. While there have only been a handful of reporting bills that have become law, it does seem like a trend that covered entities need to prepare for. What are the challenges that your customers are facing in trying to gather this information?
Yeah, like you mentioned, there's a few states already that do have reporting requirements. I think this is an area that's somewhat unknown, if you will, not quite built out. But I will say this is, an area where a lot of our providers, clients are already stretched pretty thin. And in many cases, they're looking to us to help them navigate those waters to make sure that they're in compliance to their reporting requirements. We do that today in the states that do have that obligation for our clients. So we pretty much stand ready to assist them. I would also say, the responsible thing to do is for those that are participating in 340B, expand impact reporting, right? The value being generated in the program is going to good use in your communities to serve that underserved, uninsured population. And I think we ought to be proud of being able to, to show and justify, the good work we're doing. And so I think we could be maybe a little bit more proactive in our approach to that.
Great, great. The possibility of shifting 340B from an upfront discount program to a rebate model is a major concern for the 340B provider community. What are your thoughts about this potential shift and ramifications for providers and ultimately for patients?
Generally, I think there's some legal skepticism with the rebate model. However, I'm not a lawyer, so we'll see how the courts, rule on that. But I will say on the surface, it seems it will create a new burden on the providers. Right? It's a new process, but more importantly, you're looking at an industry where financial resources are already stretched and somewhat scarce. And then, you essentially throw a delay in accessing those savings on top of that. It will have, a real-time detrimental impact to the care services. It just seems like, I don't know, it's an unnecessary distraction away from the intended mission, of the program. Just to give you a little example, we have a lot of clients that administer a 340B subsidy program. Great for the community. And think about how that's operationalized today, where the patient gets the benefit at the pharmacy counter. Well, what would that look like on a rebate program? The rebate model would really have the potential to create a very detrimental impact to the patient, a direct patient impact. And that probably should concern all of us.
Yes. So there are many folks who are concerned about it. And thanks for your thoughts on that. What are some other areas in which Pillr Health is currently helping clients?
Yeah, I know we covered much of what we do to support our clients through various products and services. Some of our, new products with SPA and ECAP. Overall, I would just say, I think because of our product dimensions that we have out here and our continued strive to innovate into new solutions to create better opportunities for the client, I think we're just very well positioned for the ever-changing healthcare demands that we're seeing. And I suspect there will continue to be, changes in the foreseeable future.
Yeah. And to that point, are there any things you think that 340B providers should be getting prepared for down the road?
Well, I think overall, we should be getting involved. Getting involved in legislative reforms could be legislation that codifies covered entities' ability to use contract pharmacies, get involved in state legislature actions, and we know those continue to expand. Getting involved in reforms around, we talked about stricter reporting requirements. I think it would be good to have our fingerprints on that, as opposed to waiting for somebody to tell us really, what to do. But at the end of the day, change will occur. We have to be resilient. We have to be prepared to innovate. And I believe we need to explore what role AI will play in 340B.
Mm-hmm. Yeah. And so many industries, virtually everybody is taking a very hard look at that and how that is impacting their work right now and the opportunities that exist for patient care, et cetera. Do you have any final words or advice for the 340B community?
Be present in the moment. There's some really good advocacy groups out there. Get involved in your state legislator. Get involved with your senators, members of Congress. And remember our mission, our why we do what we do. 340B community, right, is serving a very vulnerable patient group. And that is pretty meaningful to all of us, right? If just every day we collectively make a difference, I think we need to all stay united within this industry and really understand that we may not hear it every day, but our work is deeply valued by those that our clients serve.
Well said. Well, on that note, those very inspiring words, thank you again so much, Mickey, for joining us today. And to our listeners, please stay tuned for our next podcast, which will occur next month. Thank you for joining us today. We look forward to having you join us for our next podcast. If you're not already a subscriber, please consider subscribing to 340B Report by going to 340breport.com and using the coupon code podcast25 to receive a 25% discount. It's the best way to stay on top of the latest developments in the ever-changing 340B program. Also, check out our other podcast, Inside 340B Report, to hear our journalists discuss the latest 340B developments.